So my second lecture is on Suzuki frame application for PIP joint injury. This injury, this is unstable PIP joint fracture dislocation and PIP joint pylon fractures are among the most challenging injury treated by hand surgeon and also by orthopedic surgeon. Patient should be counseled about the severity of their injury and possibility of residual stiffness and arthritis because it's considered as a broken finger, and patient doesn't really bother that this is they think that this is a very simple injury, but it is a very complicated injury. So PIP fracture dislocation where the movement and fracture healing goes hand in hand. If joint is not moved, becomes stiff, and if it is moved, healing is the problem. So this is the first paper. I call as landmark paper by Suzuki in 1994. And to my knowledge, no paper in Indian literature on this Suzuki frame, not popularizing our part of the world. And we did 25 patients till now and waiting for a publication. So dynamic, there are many traction systems and their modification in literature, but the Suzuki frame appears to be gain more popularity, and there are the many workers out of the India who have done the studies on Suzuki frame. So what is the principle of dynamic fixator? It stimulates the nutrition and rebuilding of the joint surface by preventing intra-articular adhesions and capsulo-ligamentous contracture of the joint. So what material we required? One long 1.2 1.2 millimeter 9-inch K wire, because it should be checked ahead because many surgical centers stocks only 6-inch K wires. The 1 mm 6 inches K wire, rubber band, and if long K wire is not available, then we can use 6.5 cc screw guide wire. So I do in a flexure sheath block because I want to check it on table, the movement of the fracture. So I don't go for a brachial block. So first is the first wire, which is called as axial traction wire. If you see, it should be from in the center of rotation, and it is polarly here, and it should be equally placed. This is the first wire. Then second wire, which is called as reduction wire, which passes from the base of the middle phalanx. Okay, and we again both the wires are bent and take it away from the third wire. The third wire is the hook wire, which goes into the center of rotation of the middle phalanx here. And finally, we have got these three wires. One in the at the level of the both these two wires, proximal and distal, is at the level, and the middle wire is the little bit upwards. So that this reduction wire goes. This reduction wire goes polarly, and this axial wire goes on top of that. This prevents the subluxation of middle phalanx in flexion, because if you flex, this axial wire presses on the reduction wire. So this is the first thing is hooking is done. Needs practice. We use metal suction cannula to do the hook of the K wire. Then once we do the hook, we measure the 2 to 2.5 centimeter distance from the proximal wire. The original paper didn't mention about this. The subsequent paper has mentioned about 2 centimeter length. Then we do the proximal wire hook, and after that we prepare the rubber band from the IV set. If you see, we cut 1 millimeter rubber from the IV set. It gives a good tensile strength and lasts for a month. I call as this is an artistic construct, comes after a lot of practice. If you see, there is a equally bending of the wire. Hook is nicely made and distance is nicely maintained. And while applying the traction, beware of the over distraction of the joint. So this is on table movement. If you see, it is doing full flexion, full extension. This is because of the digital block is allowing. The second I was to emphasize is that the flight takeoff sign, it is not published. When we see this construct like inflection and extension is a sign of taking flight taking off sign, your construct is biomechanically correct. In post-op start movement after 3 to 7 days, depending upon the pain, weekly follow-up and X-ray, remove KYR after 1 month, start physio, night static dorsal splint use after that. In 3 weeks times after KYR removal, patient gets full range of motion. So these are the some cases. Case number 1, this was a very young boy, who is in Bollywood makeup artist, works as Bollywood makeup artist, and he has got a type 3 PIP fracture dislocation. It was highly comminuted. See, if you see, this is a dorsal displacement. There's a highly comminution, so we can't put a plate, screw, or any wire, and it's very difficult to treat. So we did a Suzuki frame. There is a maintenance of the joint is there, and there is no subluxation, and this is result after 3 years. If you see, he is tightly making a fist and doing extension, and if you see on the X-ray, there is a central depression, but it is not shown any arthritis, so it will not go into the arthritis at all in future also. So this is another type 2 PIP fracture dislocation, did a Suzuki frame, and this is 1 year result. Again, the patient is doing full extension, full flexion with a grip, and good healing of the bone. This is another third case, pylon fracture with dorsal subluxation. There is a fracture here, and there was some subluxation dorsally. So we add a reduction wire. Usually for a pylon fracture, we will not use the reduction wire, but we use this in this patient, and this is, sorry, and this is his movement after 1 year. If you see, again, full flexion, full extension, no extension lag, full flexion, good healing of the bone. This is fourth case, pylon fracture burst. Unable to put any implant here because it's highly comminuted. So we did only 2 wires, no addition of reduction wire here because there is no subluxation. And here is the 8-month result, good healing of the bone. But unfortunately, I don't have the clinical photo, but he has got only 5 to 10 degree of extension lag. It is expected because due to the highly combination. And so in conclusion, the Suzuki frame is most compact, comfortable, and effective. The system allows early motion. It gives good result if done properly and not violated principle and technique of original author. This is a very, very important take-home message because people do Suzuki frame, but they violate the principle of original author. So please don't violate the principle of original author because he has put a lot of efforts and time to invent this. So do with his technique, don't modify it. So thank you very much.